Hello everyone, today we'll cover another short topic which could be asked for interviews or vivas overseas like Gulf countries or any other countries, that is blood spillages. They could also ask spillages of body fluids like vomit, urine, etc. or spillages of chemicals used in dental office or even mercury spillage. Today we are covering blood spillages. How will you manage blood spill either from a container or as a result of an operative procedure like extraction, surgery, etc. Firstly, you should not procrastinate or delay to deal with blood spillage. So as soon as possible, deal with spilled blood. The spilled blood should be completely covered by disposable towels, which are then treated with either 10,000 ppm sodium hypochlorite solution or by dichlorous isocyanurate granules. So remember one thing, before you use these disposable towel and 10,000 ppm sodium hypochlorite, first thing, if you have dental team working around the vicinity of blood spillage or patients who are close to the blood spillage area, do not forget to inform them about this incident of a spillage that has occurred in their vicinity. Then immediately get a hold of disposable towels, then your solution that for use for blood spillage like a 10,000 ppm sodium hypochlorite solution or sodium dichloro isocyanurate granules. At least 10 minutes must elapse before the towels etc. are cleared and disposed of as clinical waste. The dental healthcare worker who deals with the spillage must wear appropriate protective clothing, which will include household gloves, appropriate protective clothing like PPE, which will include household gloves, protective eyewear and a disposable apron, and in the case of an extensive floor spillage, protective eyewear. Good ventilation is essential. The health and safety executive methods of decontamination says that chemical disinfection of blood or bodily fluid spillage. Blood and bodily fluids may contain a high concentration of microorganisms from known blood-borne viruses infected individuals. All spills should be made safe as soon as possible, like we said earlier, as soon as possible after the spillage is discovered. Local codes of practice should specify procedures and the disinfectants to be used for dealing with the spillages and other forms of contaminations. Local codes of practice based on the country and state you are located at. Your practice is located. Dental practices should ensure there is staff training in dealing with the appropriate procedure for a spillage. So any practice that we are a part of, or if we ourselves are running a practice, we should ensure that our entire dental team are trained to deal with spillages, especially blood spillage or any form of body fluid spillages, as they could be highly infectious at times. All the members of the dental team must know where the spillage kit is kept, how it is used and the procedure for reporting a spillage. Practices should have a designated spillage kits for body fluids, blood, chemicals and mercury. A spillage kit needs to contain the equipment and chemicals required to effectively remove the spillage and should be regularly checked to ensure that the used contents are replaced and have not expired. Very important, because we can't use it's better not to use an expired product to disinfect an area. Always to ensure that it's up to date. If it's past its expiry date, replace it with something that is active. As a minimum, spillage kits should contain a disposable apron, a scoop, gloves and eye protection, waste bag or container. Most importantly for your blood spillages, sodium hypochlorite solution 10,000 ppm or sodium dichloro isocyanurate granules. These are applied to the spillage to coagulate it, aiding removal using the scoop. Now you know why scoop is given. Blood and bodily fluid spillages. PPE, like we mentioned, required includes a disposable plastic apron, gloves, a mask, a visor or goggles. Now I have referred this topic from the government of UK publications and as well as Crispin Scully Cawson's textbook. All right, thank you.